Hi, this is Dr. Cassidy here to talk about acid-base balance and compensation. You've already learned about the basics of arterial blood gas results, but I'll just go over them again briefly as a review. The pH is related to the amount of hydrogen ions, and the range of normal pH is in the blood is 7.35 to 7.45. PaO2 is a measurement of oxygen in the blood. Don't worry about why it's called partial pressure. Just understand that its normal range is different than an SpO2 normal range. Don't be confused into thinking your patient is in respiratory failure if you see a PaO2 of 80, because that's normal. Of course, if you see an SpO2 of 80, that's not normal, and you should be addressed that immediately because the normal SpO2 is 95% or above. PaCO2 is a measurement of carbon dioxide in the blood and decreases the pH of the blood, making it more acidic. HCO3 is a measurement of bicarbonate in the blood, and it increases the pH of the blood, making it more alkalytic. Chemicals and buffers in the blood are always working to keep the acid and base balanced and within the normal range. When they're not able to maintain a normal pH, the kidneys or lungs will work to compensate for that imbalance. When one producer, lung or kidneys, of acid or base is dysfunctioning or not able to maintain a normal pH, the other producer will work to compensate. The lungs will increase exhalation of CO2 to get rid of extra acid or decrease exhalation of CO2 to keep more acid. It does this by increasing or decreasing the rate and depth of respirations. The kidneys can increase HCO3 in the blood to increase base or decrease HCO3 in the blood to decrease base. It does this by secreting more or less hydrogen ions in the urine and reabsorbing more or less bicarbonate from the urine. Let's review the steps to interpret ABG results and then add in compensation. First, you look at the pH, and if it's low, the blood is too acidic, while if it's high, the blood is too alkalytic. Next, determine the type, respiratory or metabolic. Look at the two labs related to them, CO2 and HCO3. Remember, carbon dioxide is a waste product of carbohydrates and lipid use in the body and is carried to the lungs and blood and excreted in exhalation phase of breathing. So if the problem is respiratory, the CO2 will be affected. Bicarbonate is managed by the kidneys related to many metabolic processes. So if the problem is metabolic, the HCO3 will be affected. CO2 makes the blood more acidic, and HCO3 makes the blood more alkalytic, also known as basic. If the patient has a high CO2, they have respiratory acidosis. And if they have a low CO2, they have respiratory alkalosis. If the patient has a high HCO3, they have metabolic alkalosis. And if they have a low HCO3, they have metabolic acidosis. Now, that's if it's the causative problem. Now, with compensation, if the problem is respiratory, the HCO3 will be contradictory because the renal system is trying to compensate. So it will be opposite of the pH, meaning in respiratory acidosis, the pH is more acidic, obviously, but the HCO3 is more alkalytic because it's trying to fix the acidosis. It will be higher. And if the problem is metabolic, the CO2 will be contradictory to the pH because the respiratory system is trying to compensate. It will be helpful to print this slide out so that you can refer to it as we go through the different ABG result scenarios. The acid-base balance will either be normal, uncompensated, partially compensated, or fully compensated. A normal acid-base balance has a normal pH, normal CO2, and normal HCO3. There's no problem. An uncompensated acid-base balance will have an abnormal pH and either an abnormal CO2 or an abnormal HCO3. One of them is off and is causing the abnormal pH, and the other hasn't begun to change. It hasn't begun to work to fix the pH by compensating with more or less acid or base. Remember, the body will always work to keep the pH within the normal, life-sustaining range. A partially compensated acid base will have an abnormal pH and both an abnormal CO2 and abnormal HCO3. One of them is off, causing the pH to be off, and the other is working so hard to bring the pH back to normal that it's also off. But it hasn't worked enough yet to solve the pH problem. That's why it's called partially compensated. Fully compensated is when it has worked hard enough to solve the pH problem. So now the pH is normal, the CO2 and HCO3 are still both abnormal. There's still a problem in the body that needs to be addressed, but the acid-base problem has been solved for now. This is fully compensated. Okay, look at the top of this slide. This is what you have to memorize. CO2 makes the blood more acidic, and the normal range in ABG is 35 to 45. HCO3 makes the blood more alkalytic, and its normal range is 22 to 26, and the normal range for pH is 7.35 to 7.45. For me, it was always easy to remember 35 and 45 since they're similar in CO2 and pH, and then just had to memorize the 22 to 26 for bicarb. For the test questions, you'll have the normal ranges, but it's not guaranteed, so it's a good idea to memorize these labs. Now, the rest is what's important to understand about the body and its function. And once you do understand these things on the bottom, then you will always be able to determine what's going on in your patient's body based on the ABG results. CO2 is a waste product of aerobic metabolism, which is metabolism that uses oxygen. Remember, anaerobic is metabolism without oxygen. CO2 is excreted in the blood by the cells, carried to the lungs, and removed and exhaled to air. HCO3 is a buffering agent that maintains a sub-acid-base balance of pH in the blood and is a function of the kidneys. pH normal range is 7.35 to 7.45, but the middle value, 7.40, is considered the most balanced in the blood. Any value less than 7.40 is more acidic, and any value greater than 7.40 is more alkalytic. So 7.45 is normal, but more alkalytic than 7.40. And 7.35 is normal, but more acidotic than 7.40. Please remember this concept. The kidneys and lungs work together to maintain pH balance. If the lungs aren't working well enough to maintain a normal pH, the kidneys will compensate. And if the kidneys aren't working well enough, the lungs will compensate. On the next slide, I'm going to use some visual representation of CO2 and HCO3 to show compensation. This isn't exactly what's going on in the body, but you don't need to know exactly what's going on the cellular level to understand pH balance and compensation. You can certainly research independently if you want an actual fuller description, but for our purposes, I'm taking some liberties of how things occur to provide you basic understanding, which is really all you need. Okay, for the illustrations, the blue dots represent CO2, cause and acid, and the yellow dots represent HCO3, cause and base. And we'll say that if they're equal, then the pH is balanced in a normal range. And here they are balanced within an artery, which is represented by the red rectangle. Now, while CO2 and HCO3 flow more randomly, spread throughout the artery, I am pulling them apart for the illustration so you can more easily see the changes. We'll keep the CO2 on the left and the HCO3 on the right for the remaining illustrations and say that if they're the same amount, then they're balanced. Okay, if you printed slide 3, basic ABG evaluation steps, pull it out now to help follow along. And looking at the slide, you can see that there's more acid than base, but let's go through the numbers. The low pH means the patient is in acidosis. The high CO2 explains the low pH, so we know this is respiratory related. You can see that there's more acid in this image, more CO2, and CO2 is respiratory related, so we know the cause is respiratory. The normal HCO3 shows there's no compensation. This is uncompensated respiratory acidosis. Okay, let's look at the next one. In this slide, you can see the CO2 is high, just like in the last slide, but look at the HCO3. It is also high. It has started to compensate to try to fix the acidosis. Okay, let's go through the numbers. The low pH means the patient is in acidosis. The high CO2 explains the low pH, so we know this is respiratory. The high HCO3 is contradictory. It's opposite of the pH, so it shows there's some compensation. But the pH is not normal, so there's only partial compensation. This is partially compensated respiratory acidosis. Now look at this slide. You can see that there's balance, between the acid and the base, between the CO2 and the HCO3. The pH is normal because there is balance, but the CO2 and the HCO3 are both higher than normal. Now let's go through the numbers. The normal pH means the patient's acid base is in balance. The CO2 and HCO3 are elevated, so we know there is an acid-base imbalance. The pH is less than 7.40, so we know that the imbalance was acidosis. It is on the acidic side of normal. The high CO2 explains the acidosis, so we know this was respiratory acidosis. The high HCO3 shows that there is compensation, and the pH is normal, so we know that there is full compensation. This is fully compensated respiratory acidosis. I hope that makes sense. If not, we'll be going through a few others. So I think by the end, it will make sense. If not, reach out to me and I will find a different way to explain it. Okay, this slide shows acidosis. You can see that the pH is low, and also the image where there is more CO2 acid than HCO3 base. Again, please use slide 3 basic ABG evaluation steps to follow along in determining what the cause is. Here, the acid, the CO2 is normal, so it's not a respiratory issue. The issue is that there isn't enough base. It's low, so the pH is acidic. Let's go through the numbers. The low pH means the patient is in acidosis. The low HCO3 explains the low pH, so we know this is metabolic. The normal CO2 level shows there's no compensation. This is uncompensated metabolic acidosis. On this slide, you see there's acidosis by looking at the low pH, and you can see that there's less CO2 in an attempt to reach balance. CO2 is an acid, so the body is blowing off more of CO2 to reduce the amount of it in the blood, to decrease the acid in the blood. It's trying to compensate for the low HCO3, which is causing the blood to be acidic. Okay, let's go through the numbers again. The low pH means the patient is in acidosis. The low HCO3 explains the low pH, so we know this is metabolic because HCO3 is managed by the kidneys. The low CO2 shows there is some compensation, but the pH is not normal, so there's only partial compensation. This is partially compensated metabolic acidosis. And here we have fully compensated metabolic acidosis. The pH is normal, but both the CO2 and HCO3 are low. Again, the pH is less than 7.40, so we know the imbalance was acidosis. The low HCO3 explains the acidosis, so we know this was metabolic acidosis. The low CO2 shows there is compensation, and the pH is normal, so we know that there is full compensation. This is fully compensated metabolic acidosis. Let's look at alkalosis. Please pull out 3 basic ABG evaluation steps to determine the cause. Here, the pH is high, and you can see that there is more bicarb, HCO3, than CO2, and you can see this is alkalosis. Now let's go through it. The low CO2 explains the high pH, so we know this is respiratory, right? If HCO3 was high, this would be alkalosis, but there is a low CO2 causing the alkalosis. So we know this is respiratory. The normal HCO3 shows there is no compensation. This is uncompensated respiratory alkalosis. In this slide, the HCO3 starts to lower to compensate for the low CO2. Same thing. The high pH means the patient is in alkalosis. The low CO2 explains the high pH, so we know this is respiratory. The low HCO3 shows there was some compensation, but the pH is not normal, so only partial compensation. This is partially compensated respiratory alkalosis. And here there is balance. The pH is normal again, but we know there's an imbalance because the CO2 and the HCO3 are both abnormal. The pH is greater than 7.40, so we know the imbalance was alkalosis. The low CO2 explains the alkalosis, so we know this was respiratory alkalosis. The low HCO3 shows there was compensation, and the pH is normal, so we know there was full compensation. This is fully compensated respiratory alkalosis. One more scenario, and you probably guessed it, it's metabolic alkalosis. You can see there's way more bicarb than CO2, so this is clearly alkalosis. But please pull out slide 3, basic ABG evaluation steps one more time and follow along with determining the cause. When we look at the numbers, it's clearly metabolic alkalosis. The high pH means the patient is in alkalosis. The high CO3 explains the high pH, so we know this is metabolic. The normal CO2 shows there's no compensation. This is uncompensated metabolic alkalosis. Here we can see the CO2 is elevating to match the HCO3. The high pH means the patient is in alkalosis. The high CO3 explains the high pH, so we know it's metabolic. The high CO2 shows that there is some compensation, but the pH is not normal, so only partial compensation. This is partially compensated metabolic alkalosis. And here we have fully compensated metabolic alkalosis. Please pause the video and read the full description before moving on to the next slide. Now I want to quiz you a little bit and make sure you understand how to determine the acid-base imbalance caused from fully compensated ABG values. Now keep in mind, this is only one piece of data, and in the clinical setting, you'll have the patient with signs and symptoms and other diagnostic results to guide your understanding of their condition. But you do need to understand ABG results and what they mean. And you'll have to answer test questions without other data to guide you. Okay, person 1 has fully compensated what? Fully compensated respiratory alkalosis. The pH is on the alkalytic side of normal, and the low CO2 explains the alkalosis. Person 2 has fully compensated what? Fully compensated metabolic acidosis. The pH is on the acidic side of normal, and the low HCO3 explains the acidosis. Person 3 has fully compensated what? It's on the alkalytic side of normal, higher than 7.40. The high HCO3 explains the alkalosis, so it's fully compensated metabolic alkalosis. Person 4 has fully compensated what? We know it's on the acidic. We know it was acidic because the pH is on the acidic side of normal. The high CO2 explains acidosis, so it's fully compensated respiratory acidosis. Person 5 has fully compensated what? How would you know? Really, I don't think this would happen in real life because the body probably stops compensating as much once the pH was in the life-sustaining normal range. You definitely won't see it on an exam, so don't worry about it. I just wanted to point out that the body works only to get you within the life-sustaining range. It wouldn't pull you all the way to the other side as compensation. Okay, here are links to 2 practice quizzes. There's 20 questions in each, and they're good practice for questions that will be on the exam. They're the same links that I have in the student prep. These are my references. And here's my contact information if you have any questions. Of course, you can find me before or after class as well.